Bismillahirrahmanirrahim. This video describes mechanism of bone calcification. The osteoblasts are specialized bone forming cells and they secrete monomers of the collagen, and these monomers then polymerize to form the collagen fibers, and they also secrete ground substance, and this ground substance is mainly proteoglycan such as chondroitin sulfate and hyaluronic acid. The secreted material form a soft unmineralized matrix that is called osteoid, and this is similar to cartilage in texture, but unlike cartilage it allows calcium salt precipitation. The osteoblast, they may get entrapped and transform into osteocyte. So some these osteocytes are mature and less active. They are quiescent cells. Then calcification begins. The calcium and phosphate ion begins to precipitate onto the collagen fiber, mainly as hydroxyapatite crystal. This solidified the osteoid, turning it to a mineralized bone. So the key properties of this process is that this is the highly regulated to avoid abnormal calcification in soft tissue, and vitamin D, parathyroid hormone, and calcitonin influence the rate and balance of calcification. The resulting bone is strong yet dynamic and capable of remodeling in response to physical and metabolic needs. Within a few days, the osteoid is laid down by the osteoblast. The calcium salts start to precipitate on the surface of the collagen fiber. There is development of tiny nidi. These are the nucleation point that form along the fibers. These act as seeds for crystal growth. So days to week pass, and then there is development of hydroxyapatite crystals. The first deposits are amorphous calcium phosphate such as calcium hydroxyphosphate plus 2 molecule of the water and Ca3PO4 with 3 water molecule and many others. These are non-crystalline, soft, and they are formed quickly. Then they are substituted, and there is addition of atoms, and then over weeks and months these amorphous salts are transformed into hydroxyapatite, and this amorphous salt is a mobilizable pool. A small fraction of amorphous salt, calcium salt, they remain unconverted and they are easily mobilized if calcium level falls in the extracellular fluid. This forms a rapid response reserve for the calcium homeostasis. So bone calcification is not immediate. It starts with soft, flexible deposits. Over time, the bone hardens as stable crystal forms, and the balance between amorphous and crystalline calcium salt support both the calcium, support both the strength to the bone and mineral balance. So earlier we have seen that the pyrophosphates are the natural inhibitors of bone calcification. It inhibits the bone calcification. It prevents hydroxyapatite crystal from forming too soon or too much. This keeps unwanted calcification uh, in the soft tissue and joint in check. The TNAP or tissue non-specific alkaline phosphate is another regulator of pyrophosphate and bone mineralization. It breaks down pyrophosphate. This TNAP or tissue inhibitor, tissue non-specific alkaline phosphate, it breaks down the pyrophosphate and it is secreted by osteoblasts into the osteoid. The effect is decrease pyrophosphate. Then, due to this decreased pyrophosphate, the calcification is allowed. So its deficiency, TNAP deficiency, causes soft bone seen in mice model with low TNAP. Then nucleotide pyrophosphatase phosphodiesterase NPP1. It is its role is to generate extracellular pyrophosphate. So the result is the pyrophosphate formation outside the cell. So this inhibits calcification and deficiency leads to too little pyrophosphate or excessive. This too little pyrophosphate will lead to the excessive bone calcification or formation of bone spurs. Then there is ANK or ankylosis protein. This transports pyrophosphate from inside the cell to the outside. This ANK protein is a transporter of the pyrophosphate from interior of the cell to outside and it helps to maintain extracellular pyrophosphate pool. Its deficiency also causes excessive calcification, especially in joint, and this ANK is linked to ankylosing spondylitis. So too much of the PPI or pyrophosphate inhibits bone hardening that lead to soft bone or hypomineralization, or too little pyrophosphate lead to uncontrolled mineralization that results in bone spurs formation or ligament calcification. So once PPI is broken down by TNAP or tissue non-specific alkaline phosphatase, calcium salt can crystallize along the collagen fiber that forms hydroxyapatite, the hardened structure of the bone. Thank you for watching this video. If you have any query, please write in the comment box.